Senator Akone Yayin, representing Afua-Ibom South Senatorial District. Mr. President, distinguished colleagues, thank you for the opportunity to lead a debate on the bill for an act to establish the Sickle Cell Disease Research and Treatment Center. You will please recall that the bill was read for the first time in this hallowed chamber on Wednesday, 2nd of March 2022. This bill seeks the establishment of sickle cell centers to provide for research, advocacy, and treatment of sickle cell disease in Nigeria. The centers are to be established at teaching hospitals across the country. The alarming and endemic nature of sickle cell disease in Nigeria makes it imperative for the establishment of dedicated center to give citizens of Nigeria access to better medical care in the fight against the disease. The necessity of the bill. Mr. President, distinguished colleagues, sickle cell disease is a pernicious disease that is peculiar to the black race. Nigeria, as the giant of Africa and the largest black populated country, has been gravely impacted with the disease. Sickle cell disease is an inherited blood disorder caused by genetically determined change in the chemical constituents of hemoglobin, thus affecting the oxygen carrying capacity of the blood. Sickle cell disease have devastating effects on the social/economic life of patients and the family. Sickle cell anemia, commonly known as SS, is a predominant gene common in Nigeria. It can lead to many growth, stunted growth, pulmonary hypertension, organ damage, blindness, leg ulcer, constant and periodic episodes of pains, among others. The World Health Organization during the 2021 World Sickle Cell Day labeled Nigeria as the global epicenter of sickle cell anemia, with about 150,000 annual births of children with the disease, which accounts for half of the global figure. This figure is alarming and quite distressing, as we are well aware that births in the local areas are not documented, and therefore the true figure might be quite higher than the above. It is estimated that there are about 40 million carriers of the AS gene in Nigeria, which makes it imperative for declaration of state of emergency against sickle cell in Nigeria. The World Health Organization recommends that where disorders are common, special dedicated centers are required to ensure adequate services for treatment and prevention. That's quoted from the WHO 1994 Guideline for Control of Hemoglobin Disease. In Nigeria, the only dedicated center for sickle cell disease is the Sickle Cell Center in Lagos. Action must be taken to educate the citizenry. The Nigerian state have been accused of not doing enough to help the victims. This situation must be addressed. Mr. President, distinguished colleagues, this bill essentially seeks to provide for the establishment of the Sickle Cell Disease Research and Treatment Center in teaching hospitals across the country. The objectives of the bill are stated in Clause 2 of the bill, which provides as follows: to provide leadership in sickle cell disease research, surveillance, and treatment, to guide scientific improvements to sickle cell disease research, management, treatment, and care, to conduct early screening for detection of sickle cell disease in partnership with hospitals and healthcare centers, to coordinate and liaise between the wide range of groups and healthcare providers with an interest in sickle cell, to develop programs for the education of the populace regarding the nature and the inheritance of sickle cell disease. The bill has 14 clauses, including establishment, functions, interpretation, and short title. Mr. President, distinguished colleagues, we are all witnesses to the toil, sweat, and effects of sickle cell disease on Nigerians. As we all know, one person or the other who has lost a loved one through this disease. It should not always be a death sentence to the unfortunate victims. This bill can help put in mechanism to kickstarting a better future. Dedicated sickle cell centers are important for addressing the problem of sickle cell disease, as evidenced by its success in the USA, where life expectancy in persons with the disease has risen from 14 years to 53. We can do it also and give our people a better life. Distinguished colleagues, I strongly urge that you support this bill to go through the second reading. I so move. Thank you.
Distinguished Senator Sam Egwu.